Hello, thank you so much for joining us. My name is Courtney and I work on the social media team here at Children's Hospital of Wisconsin. Today we have a very exciting live broadcast in store for you. I am joined by two nationally certified board lactation consultants here at Children's Hospital of Wisconsin, and we're going to talk about breastfeeding tips and talk about how important it is to breastfeed to provide the best nutritional care for growth and development of your child. Thank you to those of you who have already submitted your questions in the comment section of this video. We look forward to talking about more of those as we go through the broadcast. In addition to that, those of you that are just joining, please feel free to add your questions in the comment section of this video, and we will get to them as time permits. Without further ado, I introduce to you Linda and Lisa, who are part of our lactation consultant team here at the hospital. Linda, why don't you start by telling me a little bit about your job here at Children's?
Thanks for joining us, everybody. My name is Linda McNamara, and I'm a nurse, internationally board certified lactation consultant here at Children's. I came here about 22 years ago as a NICU nurse, and in 2002, when we opened the new unit, I started doing lactation. So I've been doing that for 14 years now, and we go throughout the whole hospital, helping moms, whatever floor they're on, provide breast milk to their babies through pumping or help them breastfeeding or other issues that might come up with their lactation, experience. We also have several certified lactation counselors that are nurses throughout the hospital that help us a little bit as well. There's 4 of us on our lactation team, 4 of us that are nurses that are IBCLCs, and this is all we do now in Children's.
Thank you very much. And Lisa, can you just tell me a little bit about the support and guidance you provide to families here at our hospital?
So we provide a service line with the lactation services from before babies are even born that we meet in the maternal fetal care center. So we're honored and privileged to meet families who know that their child is going to be born with some congenital defect. So we get to meet them and share knowledge about the lactation and what breast milk can do and what it means to help their child to have best nutrition, get them ready for that, educate them, then meet them either in our neonatal ICU or our cardiac ICU after they deliver, and then follow them through that. And then once they're discharged, we will follow them in our clinics. And we also have an outpatient speech and lactation clinic where we can meet them as well. We then follow all the patients that are inpatient here at Children's Hospital in any floor, from our oncology unit to our surgical units, medical ICUs. So we are on every floor here, as well as any clinic in our clinics building, as well as taking calls. So we cover a lot of territory every day, meeting wonderful families and their children to individualize care plans for best nutrition every day.
Great, thank you. So now you guys are bedside nurses here that are specialized in pediatrics.
Yes.
But you're also internationally board certified to be lactation consultants here to follow the families, and it doesn't matter that they just be in our NICU, it's anywhere in our hospital here. Great, thank you very much. All right, awesome. Well, I think we'll just jump right in with the questions that we got ahead of time. Again, if you're just joining in, please feel free to join our conversation by adding your questions to the comment section of this video. I guess we'll start with Amanda's question. Her question was, any advice on getting a 1-week-old to latch correctly? She will only use a nipple shield at this point.
And thank you, Amanda, for that question. I think there's another friend that had some similar questions about latching and emptying the breast. I think in the first week it's the hardest because babies were not born to be breastfeeding immediately. They were swimming around in utero having protein smoothies with the amniotic fluid, and they didn't have to bring their tongue off the top of their mouth to bring it out past the lower jaw and then take that lower jaw and rock it into mom's breast. That the baby needs to latch on 1/2 inch to 1 inch deeply with flange lips, have the lower tongue cupped out past the lower jaw, rocking that lower jaw into the breast, and then swallowing. So that whole suck, swallow, breathe pattern. What type of birth process did they have? Is there a tongue tie? Is there a lip tie? There's just all these different variables. And so that's where we are very individualized in our plans with our families. So that's where sometimes a nipple shield might be needing to be used just because of different things going on with the baby per assessment, and that's where we look to assessing each feeding and see how we can modify things and then optimize it and then hopefully wean from use of the nipple shield.
Great, thank you. So I think Kelly and Erica kind of had branched off this question. How do you know if a baby's getting enough milk? So the latching may or may not be working. Maybe you aren't familiar with that. But how do you know if the baby's getting enough milk? How do you measure it, that kind of thing?
The other key is proper positioning at breast, because you always want to, when you're holding the baby, you want baby to be nose to nipple, tummy to tummy. Some babies might need more of a sideline position just because of flow or various things with how they're breathing. So what we're doing is we're individualizing how we have the baby held, head above the heart, when they're feeding, how mom's holding and positioning her breast. Does mom need to do breast compressions as she's helping with feedings, so that we can attain that half an inch to an inch deep? Is mom's breast full before the feeding, and then it's softening as the feeding is happening? So that's how we know baby's getting it, as well as the swallows. So as the baby is suck, swallowing, and then breathing, are we hearing a meaning that the baby is swallowing? So we want to always be hearing a swallow. If the baby is having more of a suck that's up and down type of movement, that's more of a non-nutritive, not getting any milk.
Okay.
So they can be sitting there doing that all day, like they would on a pacifier or your finger if you weren't using pacifiers, but there's no milk getting to baby. And so that's where it gets really stressful. Are they getting milk or not? So listening for that swallow, as well as your breast softening, if it was fuller before the feeding.
Okay. And how often should a mom be breastfeeding? Is that kind of dependent on the parent, or?
The baby should be eating at least every 3 hours if they're eating a little bit sooner, but we want them to also finish the whole meal. The first milk is more thin as your milk is maturing. It takes 2 weeks to get to fully mature milk. You have colostrum the first 1 to 4 or 5 days, then you go into transitional milk, and then by 2 weeks you're going to have mature milk.
When you say 2 weeks, 2 weeks post-delivery?
Yes.
Right. Okay.
Perfect. And so as it's doing that transition, that mature milk, the first milk is more thin, more like skim milk. Then it goes to 2% where the fats are getting higher. The end milk has the highest hind milk fat content. That milk is harder for baby to get out. So sometimes the baby might cry a little bit, fuss a little bit more. And that's where we also have to look at positioning, because we want baby to be hugging the breast, having both arms around the breast, and baby might be touching the breast, helping bring that milk down as mom's doing a compression, because that fatty milk is harder to get out. So you want to make sure you do that to get that whole meal so that they're growing really well. They're not just staying hydrated from the skim. They need that whole meal in the whole breastfeeding.
Another question that we got was, how much milk should I be making? Now, we talked about the 2 weeks, it's the thicker milk versus the skim milk.
The average that we would look at research-based would be 20 to 25 ounces by 2 weeks a day in 24 hours. That would be the goal, the standard average.
Okay.
The women who are just breastfeeding,
variable.
they should be nursing 8 to 10 times every 24 hours. Getting 6 to 8 wet diapers, but every time you're nursing, you're changing a wet diaper. And yellow curdy stools, that'll tell you that the baby is nursing to get to the hind milk, and that's the milk they need to take in order to grow. If they're just taking the skim or the 2%, the stuff that first comes out, they'll have liquidy green stools, and they don't gain weight on that
And they're
milk.
more fussy. They'll stay hydrated, but they won't be gaining weight.
Right.
The other thing about the first week is day 1, you're going to have 1 wet diaper. Day 2, 2 wet diapers. Day 3, 3 wet diapers. Day 4,
So it's a build-up.
4 wet diapers. So it's a build-up. And then day 5, 5 wets. Day 6, 6. And then after that, you always want 6.
So you're saying 6 diapers throughout the course of the entire
At
day?
least. If you
Every
have
24
more,
hours.
total bonus.
Okay.
Right.
But that would be bare bones that first 6 days.
But it's not unusual to see 1 wet diaper or 2 wet
The
diapers,
first day,
you know, the
until
first
your
couple
milk
days.
comes in.
Okay.
Yeah,
Yep,
until your milk
because
comes
your
in.
milk is super concentrated. The colostrum, just 5 cc's of colostrum in day 1 to 2 is equal to a whole ounce of your mature milk. So that's where smaller volumes, their tummies are much smaller. And then
Okay.
it builds gradually. That's why you don't have this whole supersized value meal day 1.
Great.
Right.
It slowly increases.
Thank you. I think, Linda, I'll have you answer this question. Is there anything I can do or eat to keep my breast milk flowing? I think Clara had asked that one, and also Erica had kind of built off of that.
So there's no magic food, obviously, to eat to make breast milk, but, however, you need 500 extra calories per day when you're lactating than an average woman who's not lactating or pregnant. When you're pregnant, you need 200 to 300 more calories per day. So you actually need more food making milk than you did making the baby. And moms often think, well, I'm not pregnant anymore, I can't eat like that, but they need to keep eating enough calories to help the mothership make this milk. And you need extra protein, so you need to be getting protein at every meal. That's the meat, cheese, eggs, dairy, fish are the complete proteins. The incomplete ones are the grains and the vegetables. You have to eat them in combination. So you need 40 extra grams of protein per day, as long as you're eating enough protein at your regular meal. So it's just like an extra handful of nuts or chicken breast or something.
So
But
more,
that's your best bet.
so more food, healthy foods,
Yes, healthy
proteins are
foods.
going to help it.
And drinking enough fluids. I always tell
Okay.
moms, we're not camels. We don't store fluid somewhere to make milk with. So if you don't put enough fluid in, your body doesn't really have a lot to make milk with. So you tend to be more thirsty when you're lactating, and that's the body's way of telling you need to be drinking more. But eating a healthy diet and get enough calories, take your prenatal vitamins still. For our vegetarian moms out there who don't eat the animal proteins, they need to make sure they're taking in vitamin B12 because they're not going to get that
Okay.
because they're not eating meat.
Yep.
So they just need to make sure that they're on top of that. Most vegetarians are aware of that, but in case you're not, you need to still maintain your personal health as a vegetarian while you're lactating.
Great, thank you. For those of you who are just joining in, thank you again for coming on in to listen to our live broadcast here on breastfeeding and breast milk. If you have questions, please feel free to post them in the comment section of this video. We will get to them as we can. Looks like we just had someone ask a question. Corey, can you tell us?
Sure. Kristen asked, I can only nurse 2 times a day because I'm at work. My milk production has decreased a lot. How much is average to get when you're mostly only pumping?
Well, that depends on how old the baby is. But let's just say the baby's, I don't know, a month old. The average is about 2 to 3 ounces per pump session. Some moms make more, but if you make less than that, then you might be not making enough milk for your baby. That's assuming you're pumping 7 to 8 times every 24 hours. If you're pumping, once a day, and you get 2 ounces, well, that's a pretty low supply. But on average, women, when they pump, will get 2 to 3 ounces each time they pump, or more.
It would be nice if you're able to pump both breasts at the same time as well, because you're time constricted at work. So some of our moms will get a pumping band or make their own pumping bra so that they can do hands-on pumping. Dr. Jane Morton has a video hands-on pumping that you can find on the internet, using your hands to optimize the milk flow as you're pumping. And so we've had moms and workers here that are like, oh my gosh, ever since I got that band, I'm able to use my hands. I was able to increase my supply, and it took down their stress levels. They were feeling much more in control of a situation because they were at work wishing they were home with their babies. So,
and that could be found on the Stanford website.
Yes.
The
Okay.
hands-on pumping video. And everything we teach here at Children's is evidence-based. So if we're suggesting any kind of, helpful tips for this, it's because it's based on research. So.
Okay, great. So this question kind of branches. This is one that we got ahead of time. It kind of branches off that question. So I'd like to start pumping for my milk to store, but I don't feel like I have enough to pump and feed. I try pumping in the morning, but I still can't get enough. I can't seem to find a time where I have any extra. Are there any recommendations that what did you just mention? What was the name of it?
I think the hands-on pumping,
Okay.
in the hands-on pumping video, getting a pumping bra to hold it on so that she could be eating and drinking as she's pumping as well, so that she's hydrating herself.
Okay.
So having a big glass of water before you start pumping, and then a big glass of water after you're done pumping, or breastfeeding as well. Having a glass of water before a breastfeeding or pump session, another glass of water after, just make that a habit, as well as the good proteins that Linda discussed is a huge thing. And then I think time constraints. Sometimes people don't realize that a double electric pump is only getting out 2/3 of what's actually in your breast.
Okay.
And then the more stressed you get about, I'm not getting enough because I need 4 ounces today because this is going, it just clamps down your breasts and they don't want to release. So all these things that we were just talking about might help optimize that for her.
Okay.
But if she's pumping to go back to work as she's nursing, she can pump after she's nurses, and she'll get a little, put in the fridge.
And
Nurse,
she can
pump a
add.
little,
Is it-
get it to similar temperatures, then you can combine them.
Is it recommended that, I don't know, does it help if you're nursing and pumping at the same time?
Well,
like with
we
one and the other?
really like moms to focus on that
Okay, the hold and
experience
the,
while you're
okay.
breastfeeding the baby.
Some people
But some
choose
people
to
have
do that,
a time
and that's
constraint,
okay, but we
right.
don't want them to do it to the point of stress, because
Right.
it shouldn't make it more stressful.
Yep.
Because that, we want them to celebrate all the milk that they make, and
It's kind of a
Yep.
mental hormonal thing too. That
Yeah.
okay. How much milk is really needed to have pumped ahead of time in order to go back to work? Is there a certain?
What you need for the time you're gone.
Right, if you're,
Okay.
if
All
you're
that
going
you
back
need.
to work.
So if you're
you
just going
need,
bottle by bottle, or that's okay.
like a day at a time. If you're going back to work tomorrow, you need what you're going to need for that day.
Yep.
So
Great.
maybe 2 or 3 or 4 ounce bottles of breast milk.
And
If you're going to be pumping when you're at work to
Because
kind
the
of
more you stress out about, I need this much for the whole week,
you don't need that.
doesn't allow you to
You don't need it
celebrate
for the
how
whole
much
week,
you
you need
really
it for
have.
right now.
You
I
just
mean, if
need
you
it for-
have it, that's fine, but
Right.
you don't have to have it that much.
And so in a typical 8-hour day, how many times should someone be pumping, would you say?
If they're just pumping,
every 3 hours would be the goal.
yep,
Great.
7 or 8
Awesome.
times a day.
I think we had some Facebook questions come in. Corey, do we have any questions?
Yeah, a couple more questions just about returning to work and increasing the milk supply. I know you guys just touched on that, so I'm wondering if there's any more tips you have for those moms who are preparing to go back to work and might have that anxiety about their supply of milk. I know you touched on that already, but are there any other tips you have for our fans out there?
I think taking care of themselves and good protein snacks as they're at work that day, pictures
Right.
of baby, just positive things.
Really setting aside the time
Yes.
to pump at work. I mean, your employer should give you the time
important.
to go and
There's a
pump.
federal
Don't try
law.
and avoid it.
Right.
Okay.
They can't really
There is a law.
say you can't, so.
Correct.
Okay.
And Jennifer had a question. What is your opinion on power pumping? I'm not sure if you guys know what that means.
That means if you,
just talked about
it helps with the pumping bra. You're going to sit down for an hour, turn the pump on for 10 minutes, turn off for 10 minutes, turn on for 10 minutes, off. It's a way to simulate a growth spurt that a baby has. Because when a baby has a growth spurt, 3 weeks, 6 weeks, 3 months, 6 months, they go to the breast constantly. Normally a baby breastfeeds 8 to 10 times a day. They'll go 12, 14 times a day.
Okay.
They want to just nurse frequently for a day or two. It's the baby's way of telling the body to make more milk. The more often you empty your breast, the more milk you'll make. So if you're trying to increase your milk supply, which we have to do often with our moms here in the NICU particularly, and we tell them to do this power pumping once or twice a day. And in a day or two, you might notice, well, I'm getting a half an ounce more per pump session. But if you're pumping 7 or 8 times a day, that's 4 ounces more per day. So that's significant. So it does work. So
The biggest thing is we want to make sure that those flanges are properly fitting the mom when she's pumping. And then having
Right,
that
that could
pumping.
affect your supply,
Because a huge thing that can affect your supply is a too big or a too small
Yes.
flange. So that's something that another person did ask us about, that we did want to talk about. So power pumping can be very helpful, but we really need to make sure that the flange is properly fitting mom's anatomy. She might need one size on one breast and
Okay.
another size flange on another, depending on her anatomy. It's not one size fits all. And so that's where it's really important to have an internationally board certified lactation consultant, if possible, evaluate that those flanges are properly fitting when mom's pumping.
it should never hurt.
It should be a tug. It should never be a pinch.
You don't want to go too high. Mom's like, I'll go
Okay.
higher on the pump and I'll get more milk. It actually collapses the duct. So you should pump to where it's comfortable, and the flanges should be comfortable too. If they're not, then someone needs to evaluate that and get you a different size.
Okay. Another question came in. Is it normal for the milk letdown reflex to decrease, not feel as strong, or become absent? Does that imply a low milk supply?
No, and some moms don't even feel a letdown. So it depends. So if it,
Can you define a letdown for those of us who don't?
the
aren't
letdown
familiar?
is when the fat milk, when the back ducts comes forward. So I used to feel a tingly, weird feeling, or when you're pumping, you can see the spray coming. That's the back ducts opening
Okay.
up. So that's called the letdown. And so some moms will feel it, or they'll start leaking or whatever, and some moms don't.
But it
So-
doesn't. It doesn't mean a low milk supply. by
Yeah,
any
and
means.
sometimes as you get further into your lactation experience, it's months into it, your breasts get a little more efficient, a little less full, and they often feel like they're not even making milk anymore, but
Okay.
indeed they are. They just aren't as engorged or, swollen as they are in the very beginning.
And if
so.
baby continues to gain
Right.
weight properly on the growth chart is really the biggest piece that we
Okay.
would be looking at.
Right.
So I'm hoping we're understanding this question
Yeah.
properly.
Yep.
Not all moms continue to feel that letdown
Right.
because they're not as engorged like Linda said, but that's where we really need to look at how is baby growing.
Mm-hmm.
That's going to be the big piece.
Yeah, if your baby's gaining weight, you're doing it right.
You're fine.
Great.
Yeah.
But if we're falling off the growth curve and we're not
Right.
feeling things anymore and we're not latching, then that would be time to call a doctor.
Okay. And then just kind of a random question that was in there. Should breastfeeding moms avoid certain lotions or soaps? Does it matter? Like, as the baby's eating, I mean, is it bad to use scented lotion? Is that okay?
I
would have probably avoided
I
putting on the
avoid
nipple.
some-
I don't think
right.
as a human being I'd want to be
Okay.
eating
certain
that, so.
essential oils should not also be there for
Okay.
a neonate. So
Yeah.
I think that would be something she should discuss with her pediatrician.
Okay. And then it looks like we have some more questions coming in via Facebook. Corey, can you?
Sure. Jennifer asks, does a baby who clicks his tongue when nursing take in too much air, or why is that a no-no when latching on?
It means that the tongue isn't able to go under that breast nipple and get in there deep enough to bring the milk forward for a baby to swallow. So that means it's not a proper deep latch.
Right.
So the tongue is clicking up onto the top of the mouth, and it should be underneath that breast and the nipple, half an inch to an inch deep.
How can you change that? Is there
Positioning techniques.
Okay.
Seeing an internationally board certified lactation consultant, and possibly in our outpatient clinic we have a speech pathologist with our internationally board certified lactation consultant, where we actually evaluate the oral motor component.
Okay.
So that's why we're a team, and we're also by the ENT clinic should there be a tongue tie or a lip tie or anything like that. So that's why we have that constellation of services in our outpatient program.
Great, thank you. We have another Facebook question.
Monica asked, does brick dust in diaper mean baby is dehydrated?
Brick dust is a new term to me, but if it could be a sign. That's why I would call the pediatrician. I'm thinking she's meaning that there's not enough urination. So I have not heard the term brick dust before, but I would call the pediatrician if she's seeing any brick dust.
If you're seeing an abnormal diaper, you need to be seen.
Yeah, you need to call the MD right away.
Great, thank you. We'll jump more to the questions that we got asked ahead of time. Hope had asked, are there suggestions for a distracted nurser if going into a dark room isn't an option?
Oh, isn't an option? Well, that's your best bet, but...
Right. I think any time that you can decrease some of the stimulation, if there's older siblings and stuff, could they be playing with Legos versus like beeping
Watching a
trucks
movie or
and
whatever.
watching a loud movie and things like that? As quiet and calm as you can have it. If you need to pull the shades just for that feeding,
For a nursing shield, maybe?
If they'll allow a blanket over,
Yeah, some babies don't like that.
they don't like the blanket.
But
So
if it'll
as
work,
much as you could, to do all of those things, but just sometimes even the sun coming in from outside could be too distracting. So if it's okay to pull those shades for that 15 to 30 minutes to do that and distract older siblings, or if she's watching other children.
Okay. And then the other question that Hope had said, my son seems to prefer my slacker boob. Is it possible that he's able to extract more milk than my pump is?
So a slacker boob terminology possibly means it doesn't pump as much when she's pumping, is what we're thinking, is what she's meaning. So sometimes that breast might not pump as much out, but we would have to look at the ductal components, like how much is the ductal storage on that breast. So he might prefer it because it's a slower flowing, more continuous flow, and so he appreciates that, where the other one might be so fast that he gets a little bit stressed. So
a lot of babies do tend to prefer one breast over the other for many different reasons.
Exactly.
But is it possible that the pump can take out more than the child?
Usually the baby can get more
Baby
than the
gets
pump.
more.
Baby gets more than the pump.
Because
Okay.
it's just a machine, but with a slacker boob, it might just be more of a comforting flow for him, and that's where he prefers it, because one's always going to provide more than the other when each
and
breast.
honestly, I think 90% of women, one breast always makes more than the other.
Okay. Looks like we have more Facebook questions coming in. Thank you, ladies.
Beatrice asked, I have frozen breast milk that is over 8 months old. Can I still give this to my baby, or should I throw it out? There are websites that say it's okay to freeze breast milk up to 1 year, others less than 6 months.
Can I just add in real quick? I think we had a couple of questions that came in about storing freezing milk. So let's just get on that topic while answering Beatrice's question.
So thank you for that question, Beatrice. If you have a deep freezer that's just solid deep freezer, it's for 1 whole year. So that would be okay for you to continue to feed it. If it's a freezer above or below your refrigerator, that's just 3 months. And we always suggest that you put it in the farthest back of that freezer that would be above or below in your refrigerator, just because with doors opening and closing, so that it stays as frozen as possible.
So it shouldn't unthaw and then you can't. So if you unthaw milk, you have to use it right away.
Well, it depends.
If the whole, say 4 ounces gets unthawed,
it's
in
completely
that whole thing,
liquid.
and it's completely liquid, you have to use that in 24 hours. If you have 4 ounces and 1 ounce is thawed, the 3 ounces are still solid. Per the Human Milk Banking Association of North America guidelines, you can refreeze it.
Yes.
All of it? You don't have to dump out that 1 ounce?
you can
Okay.
refreeze it.
You can refreeze it. If you feel that you need to dump it out, you can. But if it's a solid mass and it's over 1/2 the volume,
It's
you can
still
refreeze
frozen,
it.
yep.
And what about, are there any rules to rewarm breast milk from a bottle that wasn't originally finished?
Yeah.
So they pumped and they fed it to the baby. Can you rewarm it or use it a little bit later in that day?
Once a baby eats it from a bottle, you put 3 ounces in a bottle, the baby sucks and only takes 2 ounces. That 1 ounce has to be fed within the next hour.
Okay,
You can't put
so
it back
right
in the
away.
fridge. You can't stick it back in warm water. They can eat it within an hour, but after that you have to toss it.
Just toss it. Okay. Great. Thank you very much. Abigail had asked, how can I encourage my cycle to return while continuing to nurse my 10.5-month-old? We'd like to have another baby sooner rather than later.
So with Abigail, that would really be up to her spacing out the breastfeedings or pumpings to longer sessions. When you're exclusively breastfeeding and you're breastfeeding around the clock, your body gets used to that so your cycle doesn't come back because you're stimulating yourself. So it would have to be, if you and your significant other are comfortable with that, that would be how to space it out further, the
Okay.
breastfeedings, if her body can tolerate that and baby's okay doing that.
Okay. Looks like we have another Facebook question.
Sure. Kathleen asked, my son is 11 months old and recently he started biting me when nursing. Do you have any advice on how to get him to stop?
Keep saying no. When
Take
they go
him
to bite
off
you, you take him
immediately.
off right away. He does not get the thing that he wants, and then he bites you and you say, no, don't bite mommy. And because my daughter used to do that. She did it to me once, then she tried to do it again. I just took her away, and then she realized if I don't do that, I'll get to nurse. So but they do it once or twice, most babies, and then if you just say no and take them away, they'll stop.
And it's hard. It's very emotionally hard
Yeah.
for mom to do that. But
Great. Another question?
And she had a follow-up question on that. Since the AAP recommends breastfeeding for 2 years, would this be just once per day? I'm looking to decrease my supply down to AM/PM feeds.
That's fine. I mean, by that point, I nursed my dog till she was almost 2, and it was in the morning, sometimes before nap, sometimes before bed, sometimes she'd skip a day. I mean, at that point, they're doing it. They get some nutritional components, of course, but it's, it's more of a comfort thing.
And there's still that connection between the mother and baby.
and I would
Yeah.
check with her
Right?
pediatrician what her pediatrician would suggest with how baby's also growing.
Right.
Great. And then Abigail had asked another question. When I head back to work in September, my son will be 11 months. Can I nurse in days with him and in the morning and evening, but skip pumping at work? How will this affect my supply? He's only nursing 2 to 3 times a day, and I'm hoping to avoid pumping again and encourage it'll be a gentle weaning.
As long as her breast will let her go that long at work without pumping. If you get uncomfortable, I would suggest you better pump, just to not let yourself get,
So how do you know when you need to pump?
Usually you can tell. Your
Okay.
breasts get full and uncomfortable, and when you're lactating, you realize it's time to either nurse or pump.
Okay.
But at that stage, she might be able to go that whole time without
Okay.
having to. Her breast might be completely comfortable and have worked its way, the
11
supply
months,
down
yeah.
at 11 months. Yeah, she might
Okay.
be fine to go.
Great. Corey, do we have any Facebook questions? We're all good? For those of you who are just joining in, please feel free to send your questions into the comment section of this video. Otherwise, we'll just keep answering the questions that we did receive ahead of time. So Becky had asked, I have very small nipples. I ended up having to give up breastfeeding because I couldn't find a pump that fit correctly. I plan on having another child and really want breastfeeding to be successful. Are there any tips or tricks for the breast type?
I think the next time she has a baby to check with the internationally birth certified lactation consultant at the birth center to see what proper flange fit would be for her, to really assess that after delivery and then as her milk comes in, just to see what fit, because somebody might be within 3 different flange sizes within that first week to 10 days. Just as the milk is coming in, you're getting very engorged, and then as you establish your supply, your breasts are changing. So just having somebody nearby to do those assessments.
Great. And then I guess a question that we kind of received several times throughout was, where can a mom get pasteurized milk if it's not possible that they breastfeed or they don't have the option to breastfeed or, circumstances, whatever is not working in their favor?
So I think we're very fortunate to have the newly opened Mother's Milk Bank of Western Great Lakes in Illinois that services Wisconsin, Illinois. And so the moms could call Susan and Summer at the milk bank in Illinois. If they have a doctor's prescription, that will be what they need to share with Susan and Summer. They will have to talk to their insurance company though, as well, to see if they will be reimbursed. Not all insurance companies pay for that. Currently, we pay $4.50 an ounce for our pasteurized donor human milk, but that would be who they should be calling to get that.
Okay, and then I guess just one last little fun fact before we wrap up here. Can you guys tell me why you love your job?
Well, I mean, it's very satisfying to help a mom in a stressful situation do one thing that they really had hoped to do. And if it's, not exactly how their plan worked out, the baby was born prematurely or born with, a heart defect or other issues that prevented from nursing right away, to still support her so that she can get her supply in, eventually nurse her baby, and provide obviously the best food you can possibly provide of any baby, but particularly one that's in the hospital or born prematurely who doesn't have an established immune system, because that's what you're going to get with breast milk. So it's a very satisfying job.
Yeah. So to me, it's amazing. I've spent my whole life here, and over 28 years of it. And it's a gift to me to be allowed into the lives of these families every day, to meet them prenatally and then follow their life journey here. Then they're taller than me, they're bigger than me when they come and visit, and they still want to hug me and remember me. And just to also help moms and dads have some control over a situation where they just don't have control, and to learn about breast milk, and to learn that breast milk has over 100 live cells in it. It has stem cells, active T cells, and what it can do for thymuses. Some babies are born without a thymus, which is your main immune gland. And so these active T cells actually are activated in breast milk. Whoever thought,
right.
And over 4 stem cells, 4 types and more coming. So I think it's just using all this research and then making it live and happen at the bedside for our nurses, our doctors. And today's a really exciting day. It's our 1-year anniversary of our human milk kitchen opening up here for our goal of an exclusive human milk diet. So it's like serendipitous. It's August is Breastfeeding Awareness Month, and here we are.
Yeah.
So thank you, everybody, for your time. This is so exciting.
Thank you. I think we've covered a lot, and we really appreciate your time. I know our fans do, and we do on behalf of the social media team. Any remaining questions? Would you recommend that they reach out to their pediatrician, birth center?
Right, or
Yes.
their OB,
Yep. I think that'd be wonderful.
Yeah.
Great. Awesome. Well, thank you very much, ladies, for joining us, and thank you, Facebook fans and all of our fans on social media. We look forward for you guys to tune in next time.